Assalamu alaikum, welcome at the North Star Ultrasound Sudanese platform ready for the ultrasound exam. Today I will present the specialist level the assessment. My name is UELGAYLANI Ali, membership in the North Star Ultrasound. I will present 50 image. Are you ready for exam? Image number 1, abdominal scan for evaluation of the liver. You see the gallbladder distended and the internal echogenic object with the posterior shadowing of the the feature of the cholelithasis in gallbladder, multiple cholelithasis, the multiple stone. Image number 2, abdominal ultrasound for this spleen. I see inside of this spleen feature of the hypoechoic mass, wall defined, smooth wall, and echoic inside of this spleen. The feature of the simple cyst. Simple cyst is rarely found in the spleen, doing by two things, maybe the congenital or traumatic. Other image for the abdominal ultrasound, the pancreas, the head of the pancreas. Seeing the head of the pancreas rounded, and the homogeneous or the hypoechoic sometimes find. According for the gain setting, rounded, and the wall defined. The feature of the pancreatic cyst. Other abdominal ultrasound, the liver. I see the liver distended. What the cause of this distended in this image? Distended may be the portal vein or this common bile duct. How can differentiate between the portal vein dilated or the bile duct dilated? By doing the Doppler, because gallbladder or the CBD, there is not see the flow, the feature of the CBD dilation. Image number 5, other for the liver abdomen. I see the speculated lesion inside of the liver, and the homogeneous or the hyperechoic sometimes. The feature of the focal fatty liver. Number 6, the abdominal ultrasound for evaluation the left kidney, capsule, cortex, medulla, and calluses inside of the pelvic junction. I see the object hyperechoic with the posterior shadowing and cause the mild hydronephrosis. These are features of the kidney stone, of the nephritis, the kidney stone. MSK ultrasound, patient severe suffering or complaint of the pain in the ankle. I see the dilation in the ankle joint. The feature of the joint diffusion, rheumatic. How can be differentiation between normal and abnormal? Measurement is a feature of the joint. It's called 3 millimeter. If you find the feature of the ankle joint more than 3 millimeter, the feature of the joint diffusion and the rheumatic. Abdominal ultrasound for this patient come for the hypotensive and suffering from this pain in the abdomen. The feature of the longitudinal and transfer for the abdominal aorta. I see the echogenic wall inside of the abdominal aorta. This is a feature of the aortic dissection. This duration of the internal aortic wall. Another image of the wall thickness, the intermediate thickness of this carotid artery between the 0.4 millimeter until to the 0.774 millimeter. More than for this, it's called of the scoliosis. And this feature of the wall thickness of all the carotid artery, if the between 0.5 for the 1 millimeter, more than it's called abnormalities case. Number 10, what's diagnosis of this kidney, right or left kidney? The feature of the mild hydronephrosis, the dilation of this calluses, capsule, the medulla, capsule and cortex and medulla. The differentiating between the mild hydronephrosis and moderate hydronephrosis. In the feature of the moderate hydronephrosis, you can see the fingers. Yeah, see the fingers inside, feature of these fingers inside of this kidney. The feature of the severe hydronephrosis cannot be differentiated, or the cortico-bore cortico-medullal differentiation cannot be differentiated. Number 12, for the gallbladder, I see the sludge inside of those gallbladder are multiple echogenic with the posterior caustic shadowing. These are features of the sludge and cholecyst of the gallbladder. 12, what is position? This position is called the Valsova maneuver. The Valsova maneuver, doing the multiple things in the detective of the varicocele in the testicular. Other things can be used for the evaluation, other of the varicocele in the eye, sometimes for the evaluation of varicocele, or the dilation of the vena arteriocapillary inside the vitreous, more than used for the detection of the varicocele. Other one in the lower Doppler and in the testicular. Image 33, 13, image 13, evaluation the testicular, homogeneous, normal wall, but I see the cyst in the wall of the testicular. If you see the cyst inside of the testicular, it's called the testicular cyst. But if you see the cyst peripheral or in the wall of the testicular, that is called the tunica-albuginal cyst. Okay, differentiation by this cyst. 14, the multiple echogenic foci inside of the testicular. The cause, or the commonly cause of the microlysis in the testicles. 15, the male age, the 13, complain of the dysuria, irregular wall, urinary bladder wall, with the trabulation and the sedum of the depressed. It's commonly caused in the child. The feature of the neurogenic bladder, the urinary bladder wall, irregular with the depressed. The features of the neurogenic bladder. 16, internal vascularity, A and P. Image A and P. I see internal vascularity in this mass and other things. This, the called of the focal mass, and this is called the diffusion mass. Diffusion mass separated for all the wall of the urinary bladder, and the focal mass can be found by the oval mass or the irregular have they speculated. If the commonly it's called the masses, and what is the common mass can be found in the urinary bladder? It's called the TCC, transitional cell carcinoma. How can be differentiated between the TCC and the blood, clotting blood, by doing of the Doppler. Blood does not find the Doppler flow, but in the TCC can be found of the flow. 17, right thyroid scan. In this scan, oval masses, oval lesion, hypocomic with the internal depressed, have the head and tail. The feature of the comet tail sign is the benign nodule. 18, right breast, hyperechoic complex with the irregular border, and the WBC is high. In the features of the abscess, may be irregular and the heterogeneous inside. And 19, the breast. Woman breastfeeding should be asked patient about the history because can be helpful or help you for diagnosis the future. Lesion mass inside of this breast, hypoechoic with the hyperechoic. It's commonly seen in the breastfeeding female or the pregnant female is called the glycocele. Eye ultrasound. Eye have the multiple layer, sclera, and the mucosa at Latin of the vitreous, the vitreous. Other one, the retina. That commonly can be seen inside of this eye. The problems can happen inside of this eye. Complaint from this retina detachment. But when you see the inside of this eye, hypoechoic line inside of this eye, the called of the posterior vitreous detachment. The vitreous detachment complaint from this membrane, the thin, but sometimes can be seen detachment for the retina, hyperechoic, and with the internal hemorrhagic. Image number 21, knee. It's commonly tied from the masses inside posterior, or this is a knee caused by the popliteal, the Baker cyst. Female no married complain of the pelvic pain, enlargement mass, and the homogeneously, and the peripheral Doppler, the endometrioma or the cochlear cyst. 23, female, 26-year, non-pregnant. Other one, bilateral the ovarian. I see the multiple cystic. How come the differentiation between this cystic from the follicular cyst? The feature of the PCO polycystic. Polycystic is more than 10, and the measurement of the size less than 10. Okay, and all the measurement of the ovary more than 10. It's called of the 10 rule. 24, the 17 female pelvic pain, left adnexia. It's a female suffering from the PID but cannot be right in the report. PID is a feature of the solvents, hydrosolvents, enlargement of the fallopian tube and inside of this fluid, and is separated inside of the separate of the fallopian tube. 25, the enlargement bilateral of the ovary, WBC increase, and the heterogeneous peripheral Doppler flow. The features of the bilateral of the ovarian abscess. 26, internal Doppler vascularity. How can be differentiated between the internal cholithasis or the masses? Masses have the internal Doppler and have the posterior enhancement, but the stone have the posterior shadowing. The called of the gallbladder polyp. Define this marker from number 1 to the last one. Left liver lobe and stomach and pancreas, splenic vein, superior mesenteric artery, celiac trunk, and the aorta. The patient complain of the abdominal pain during the scan. I see dilation in this internal bowel. Internal bowel dilation in the ultrasound is called small bowel obstruction. The feature of the small bowel obstruction. Abdominal pain, other ones ileum, small bowel. I will drawing the normal ileum. It's normal ileum for the pathway, but sometimes you see this protrude from this ileum or the any part from this bowel. It's protrude is called the diverticulum, but in the small and large bowel كم diagnosed by ultrasound is called the diverticulitis. Okay, diverticulitis. Image the 13th male, 2-year, abdominal distended. See the feature of the donuts. Multiple lying inside his abdomen is commonly features of the intussusception in the abdomen.